All right, well, Democrats have been beating the drum saying Republicans get their way. Well, they're going to make America sick again. Listen.
The Republican plan to cut health care wouldn't make America great again. It would make America sick again.
All that will do is make America sick again.
And so make America sick again? Is that what the Republicans want to do?
All right, so that's the theme. Republicans are going to make America sick again. Democratic Congressman John Garamendi met with President Obama today. Sir, always good to have you. Is that a fair argument to scare people into what Republicans might be drafting? Because the facts are Americans are sicker now, and in 8 of the top 10 diseases in this country, including kidney disease, heart disease, more people are dying of them than have in decades. They're on the uptick. So actually, they're already sick, right?
Well, that has a lot to do with those particular diseases, with the aging, with the baby boomers aging. Of course, that's going to be the case. However,
I understand that, but Congressman, don't you find that disingenuous then to be saying make America sick again when Americans are sick again?
Well, you're talking about two different populations here, and clearly, if we were to see the repeal of the Affordable Care Act, there could be as many as 30 million Americans that would immediately lose their health insurance. Now, I know the Republicans say they're not going to do that, but a repeal would cause that to happen. Some 20 million that have actually been able to get insurance as a result of the Affordable Care Act, and another 10 million that are insured probably with their parents and in other ways as a result of the extensions that were provided through the Affordable Care Act. And keep in mind that for seniors, those that are in fact dying of those illnesses that you talked about, they have been able to get annual health care checkups, which has delayed the onset of those very illnesses that you've just described, diabetes, heart issues, and the like. And those have extended the, actually the actuarial foundation of the Medicare itself. And so we're seeing a lot of very good things.
I'm not saying you're in variance with the facts, but the facts that I have is heart disease deaths are up, chronic lower lung disease is up, stroke deaths up, kidney disease-related deaths up, suicides up, drug overdose deaths up. I'm not blaming that. Sir, just hear me out. I'm not blaming that on the health care law by any means. I am saying, though, it's occurred despite the health care law. So for Democrats then to point at Republicans as the evil, killers here, it seems a little bit of a bit theatrics, right?
Well, to talk about theatrics, talk about what's been going on ever since the Affordable Care Act became law, the theatrics on the Republican side. I just told you what's been going on. Well, what you've seen is all kinds of charges made about the Affordable Care Act that were not true. But we do know what is true about the Affordable Care Act, and that is over 20 million people have been able to become insured in a variety of ways through the exchanges.
But it's not affordable, right? It's not affordable. Double-digit increases, and then it's sold on the idea that it would be a lot higher without it. We can't prove it.
Now, Neil, wait just a second. Let's just step back. It is affordable because of the subsidies that have been provided. Now, the cost of health care overall, we've seen a decline in the last 6 years in the rate of growth of the inflation, below what it was in the previous 30 to 40 years. And that was in part due to the Affordable Care Act and some of the reforms that were instituted in the Affordable Care Act.
But a lot of that's years dated, right? I mean, when we had a recession going on, a slowdown, and a lot of it might just be due to that more than anything else, right?
Well,